So the second presentation is disease transmission and control. This presentation will give you some idea for FETP, field epidemiologists. So, how do they think about communicable disease? Infectious disease. In order to control or prevent infectious disease, I will give you some schematic ideas we usually do in field epidemiology. These are some key messages for this afternoon, based on this chart. We are thinking about communicable disease and control and prevention, let's say host. As human beings, this side and this part is some sort of outside of human body, exposure, infection, and disease, let's say pathogen, some bacteria or virus. This is exposed to human being, an individual host, then the pathogen can survive in the body. That infection and then the next step have some symptoms, some fever or cough or anything. That is some sort of disease status. Exposure moves on to the infection, and infection to the disease, then from the human body. Infected human body or diseased human body. The pathogen is going up through cough or through blood or whatever, in some cases. Direct contact, vector, for example like a mosquito, mosquito-borne disease, or environment. Contaminated dirty water or contaminated food, then again pathogen, through this channel, is exposed to other human body or to other host. We are thinking about this cycle in order to control communicable disease among human population. So this chart is very useful. Some of you are from hospital or clinical setting. Doctors and nurses, they are working below this line. What I want to say is doctors or nurses in the hospital are waiting for the patients and some unhealthy people who come to the hospital. And what they are doing is treatment of patients. Then patients usually recover and some of them die. That's some clinical setting. However, field epidemiologists are working for human population, so we are thinking about this cycle. It may be quite difficult to understand this chart, so I will give you some example. Did you hear about incubation period? It's exposure, for example, to virus. Measles virus is exposed to you and then around 1, maybe around 2 weeks. So some of you may have symptoms. That is called the incubation period. And this process has several factors, influencing factors. Previous exposure to measles virus, immunity, immune-compromised patients and prophylaxis, and general nutritional states, general health and immunity. These always affect or influence this process. Then as I mentioned, in clinical setting, below this line, doctors and nurses look for vital treatments and the pathogen outside the body, so there are several pathways. Direct pathway or through vector or through environment, dirty water and so. How do you think of disease prevention? Field epidemiologists think about where we should cut. So there are way of thinking epidemiology. There are several pathways that pathogen could affect the host. Direct pathway, or through the vector, or through the environment. Through this channel from exposure to infection, we can cut through vaccination. And we can cut this process from infection to disease by prophylaxis drug treatment in advance. And treatment or rehabilitation will cut the process for those who have already had disease to die, or disable or recover. And isolation will cut the process from infection or disease to the pathogen. Killing the mosquito or not having contact will cut this process. Repellents and bed nets to prevent insect bites or something like that will cut this process. So, our field epidemiologist thinks about where should we cut this cycle in order to prevent communicable disease among human population. Next, we will give you some examples. Through the example you will have some idea how to deal with the cases. This is the cycle of tuberculosis. TB is a bacterial infection. It transmits through cough to infect a person, and then surviving in the body, and create some symptoms like fever or cough or whatever, and then through droplet infected to others. This is the cycle of TB. TB may have some symptoms such as cough. There are also maybe asymptomatic TB, but in this situation, how do you put some control? Where do you cut this cycle from here to here? So as you mentioned, we have a weapon. That is vaccination to cut the process from exposure to infection, and with isolation, maybe we can cut the process from infection or disease to exposure. And how about prophylaxis? We can cut this process from infection to disease. So for TB, in this cycle, we have vaccination, prophylaxis and isolation. We have 3 points of control. And in real situation, we can choose one for considering of the current situation. We move on to the next example, diphtheria, which is a bacterial disease and a vaccine-preventable disease. It also transmits through direct contact, so we can create this chart for the diphtheria. How do you control diphtheria among human population? Where do you cut this cycle? We have weapon to combat with diphtheria, that is vaccination. This vaccine coverage, I think, is quite high in this country. And also we have some prophylaxis, and also sometimes it's very good to separate healthy children from infected children, which is a source of isolation. So we have several points to cut this cycle in order to control diphtheria among human population. Shall we move into another disease, dengue? Dengue is a viral infection through vector, mosquitoes. So we can draw this cycle for dengue. How do you control? Where do you cut this cycle? Unfortunately, we don't have the vaccine for them, while dengue has a very wide range of spectrum. So it's a good way to focus on vector and on protections like wearing long sleeves, or using bed nets, insecticide or something like that. That's a good idea. Another example is HIV or AIDS. It is retrovirus infection. This is the systematic cycle of HIV. However, there is no symptom, and AIDS, it has some symptoms, and it is transmitted through sexual activities, blood and IVDU intravenous drug use. So we can draw this chart. In order to prevent HIV or AIDS among human population, how do you put control? How do you cut? Do you have any ideas? We do not have vaccine, and we have some prophylaxis. But while they help infected people to lengthen their lives, they also increase the number of infected people. Another example is measles. Measles is a vaccine-preventable disease and a viral disease. We can draw this chart. So how do you control measles among human population? We have a strong weapon, that is vaccination for measles. These are major points for measles control: case management, vitamin A supplementation, and vaccination is the major point to control measles. So I have given you some examples. I believe you have had some ideas how to use these charts. exposure, infection, disease. For the next section in this afternoon, we will have a group exercise, so you will be divided into 4 groups. And each group will work on 2 topics that I will explain later.